Okay, this video is called Disease Theories, Conventional Medicine Theories versus Common Sense Theories. Okay, conventional medicine is very much like a religion. It's based on mysticism. It's based on this idea that the universe is unknowable, and this reductionist research that really has a preset bias looking for what it wants, and where it ends up is you must buy our drug. Okay, common sense healthcare is sort of based on epidemiology, trial and experience, and what I would call holistic research. The metaphor for conventional medicine is what I would call, I'm going to talk about some India type stuff here. Maya. Maya is sort of that what you're seeing isn't real, it's magic, it's delusion, it's an illusion, as well as the philosopher Immanuel Kant, who Ayn Rand described as the worst philosopher who ever lived, who was an evil man and the most evil man who ever lived. So she kind of reacts pretty strong against Immanuel Kant. But the gist of Immanuel Kant is he basically said, you can't trust your senses. We don't really know what we think we know because our senses are unreliable. And he's a real jerk, and he makes himself seem complicated because he's really full of BS. That's why he seems so complicated if anybody tries to read Immanuel Kant. Okay, and sort of the big magic word in conventional medicine is pharmakia. You know, sort of like an ancient Greek word, and what it really means is like sorcery and witchcraft. And I one time saw a cartoon when I was a kid, and it was like making fun of a guy that he was a ignorant savage. He had a bone in his nose. He went to a witch doctor, and it was sort of like, ha ha ha, isn't he stupid going to a witch doctor? But what you say to yourself, what is modern medicine? You know, going to a witch doctor for a magic potion. But what is modern medicine? A person goes to a doctor for a magic potion. I mean, that's what it basically is. Most of conventional medicine is selling drugs. Okay? And Ayn Rand describes this combination of a priesthood working with a tyrant. She calls the tyrant an Attila the Hun, who basically says, do what I say or I'll kick your butt, okay? And that's kind of how conventional medicine is. This is how it is. You must take our drug or I'll kick your butt, okay? And the priesthood is basically big name university sellout liar doctors who, you know, like in the Ivy League, for example, they'll kiss butt to pharmakia because that's how they get their money, okay? That's where all the grant money comes. Pharmakia has big money. They can pay the doctors to do just about anything, jump through a hoop like an animal at the circus. And the other thing I see it is that, and all these doctors, in order to get promoted and get a big salary, they have to make pharmacy happier. They'll never get asked to do a research study again. They'll be fired, or even they'll fire them. If a doctor comes up with a research study that contradicts what Big Pharma wants, Big Pharma will often pay the universities and try to force them to fire that doctor or that researcher. Okay. Another thing is reminds me of like when a company's trying to sell a used car, they'll put a pretty woman in a bikini in front of it or something to make the used car seem more appealing. Okay? And so what I'm getting at is in medicine, there is a lot of good stuff that really helps people. The emergency room deals with a lot of acute problems which are fixable and solves them. The laboratory tests provide a lot of useful information, and the fancy surgeons in certain specialty areas do valuable stuff. You know, dialysis, without it, some of those patients, they would all just die. So that's pretty valuable. Getting a kidney transplant for somebody with end-stage kidney failure and not a good dialysis option, that keeps them alive. So there are some big things. You know, thyroid replacement, it works. You know, Parkinson's medication for dopamine replacement, L-Dopa, it helps. So anyways, there are some big things, but what I'm trying to say is the stuff that actually works generates a more favorable impression than the chronic disease stuff deserves, okay? Getting back to the common sense approach here, the Indian metaphor I would use is that of six blind men and an elephant, whereby one looks at the issue like the six blind men. You know, the guy in the back thought initially it was a rope by holding its tail. The one holding the elephant ear thought it was a rug. The one holding its leg, a tree trunk, and so on. So the point was, if you see the elephant from all 6 points of view, perspectives, you start to figure out, hey, you know what, this is probably an elephant, okay? So that's what common sense is about. You look at the epidemiology. Gee, the people who eat plant diets, they don't get all the Western diseases. You do experience. I tried the plant diet for 3 months. Gee, I got skinny. My blood pressure improved. My blood sugar improved. My energy level improved. I'm not constipated anymore. Okay, so anyways, Aristotle had said the first step to having an intelligent conversation was to remove emotions, okay? And you just look at all the different evidences from the different 6 or more points of view and you figure out what appears to be the truth as best as one can tell. And you also recognize that you don't need necessarily most of the time, a magical sorcery witch doctor to help you be healthy. Most of the time, you just need to learn what you should eat, learn what you should avoid, and get some exercise and sleep, and get along with people and respect your God or however you live your life. Okay, and this has been called God's way of healing. All right. The priesthood is the health coaches, the nutrition experts, the true scientists are really trying to understand what they're seeing, not just paid off industry hacks. And the doctors that are largely exiled. Doctors get somewhat exiled from conventional medicine if they try to do too much of this nutrition stuff. Okay, so now let's look at some theories of disease. Okay, what you're going to see is a pattern in conventional medicine. Almost always, they're going to, like I said, their philosophy of so-called fake science is that the universe is unknowable and reductionist research. So what that means is reductionist research, by that I mean looking at a microscopic point of view where you have a predetermined result planned in mind by a bunch of researchers who are paid by big pharma to find something that makes the drug look good. Okay, and what you keep on turning up is, in all the medical textbooks, it's bizarre, but you keep on finding, no one knows. Everything's idiopathic, and the joke about idiopathic, the doctor's an idiot, the patient's pathetic, and it just means the cause is unknown. Or they'll sort of scapegoat and demonize one type of food, which is usually carbs. They're going to say, too much carbs, too much carbs, too much starchy carbs, okay, which is obviously a completely ignorant thing to say, but that's what they say. And so the reason I tell you this is because whenever you say it's genetic, that means there's nothing you could do about it. Whenever you say the cause is unknown, that also means, in a sense, there's nothing you could do about it. Because how do you cure any disease? You figure out what the cause is, and you avoid the thing that causes it. Okay, but if you don't know what the cause is, then you can't. There's nothing. You don't know what to avoid, so you simply are left with what they tell you is take our pill. Okay. So they say about obesity, nobody really knows, idiopathic, genetic, too much carbs, and the joke is called like carbophobia. All right, atherosclerosis, something similar. Cholesterol levels high, even though they don't exactly clarify how that happens. And all these diseases, I call them the fat Western man diseases. Obesity, atherosclerosis, fatty liver, diabetes, hypertension, and you're always told nobody really knows what causes it, okay? On the other hand, when you look at common sense, nutrition medicine right over here, well, gee, we know what makes people fat. Excessive dietary fat, high fructose corn syrup, estrogenic chemicals, a lack of fiber, flavorants that get you addicted to food, MSG, etc. And I made a lecture about all the different things that go into that. The long-term effects of omega-6 cooking oils, hydroxynonenal, and toxic lipid peroxidation, etc., etc. Okay, atherosclerosis. To make sense of atherosclerosis, you have to know atherothrombosis theory and hemorrheology. I've given a bunch of lectures on that. It's easy to learn. You just have to be aware that it exists. And once you know this, you'll just laugh at the conventional medical textbooks. They're a joke with regard to atherosclerosis. Look up fatty liver. I give lectures on that. It's pretty obvious. Similar dietary risk factors and estrogenic chemicals, GP, glyphosate is a common cause of that. Alcohol, of course. Okay, diabetes, same thing. Excess fat, especially saturated fat's the main thing, but all these other things contribute to it. Less well-known type stuff is, the effects of glyphosate, omega-6s, abnormal dietary large amounts of sodium, lack of magnesium and potassium. SERCA inhibitors are sort of a surprise contributor to insulin resistance. Mitochondria inhibitors as well. Because think about it, what does excessive saturated fat do in diabetes? It causes reversal of electron transport. So, wouldn't SERCA inhibitors, which also affect mitochondrial metabolism in a negative way, be related? Yes. What about mitochondria inhibitors? Yes, because they're all related to mitochondria. When the mitochondria is dysfunctional, diabetes if you're lucky, cancer if you're unlucky, okay? Hypertension. We know that, you read Richard Moore, etc. Excessive dietary fat and sodium cause high blood pressure, as well as a lack of potassium and magnesium. I give lectures about all these topics. So what I'm trying to say is, when you look at things in this way, what's the epidemiology? What's the personal experience, clinical experience? What's the holistic research show? And then once you kind of got a presumed hypothesis for a mechanism, then you can look at it in more detail. But you don't start out with just trying to make a drug look good. So anyways, common sense figures out all these things. All these things are defined as chronic diseases with no cure. They like to define things as chronic diseases with no cure because once it's chronic, there's no obligation to cure it. And no one follows outcomes. And that's one of the things I noticed. I used to think that just calling the disease chronic was a way you can just sell a drug for it. Say it's chronic, genetic, idiopathic. Now you can sell a drug. But it's actually more than that. It also prevents competition. As you say, this is the standard of care and it's chronic, you're basically saying it's impossible to cure this disease and the only treatment allowed is a drug. Okay? Versus when you leave things open-ended, you can say, well, let's try a nutritional option. Let's try, some other option. All right, autoimmune disease. I call these the fat Western female disease just because they're a lot more common. About 80% of them are in females. But men can have a significant number of autoimmune diseases as well. And then you start looking at the leaky gut, all these toxins again. So there's a clear-cut explanations for stuff with common sense approach and versus autoimmune disease. It gets called unknown idiopathic almost always, or genetic, and then you got to treat with these powerful medications. Diverticulosis, GERD, ain't no sunshine when fiber's gone. Basically, same old story. If you claim nobody knows, start treating it with drugs and procedures and surgeries. You know what it is? You just eat more fiber, okay? Eat more plant foods. That's where fiber comes from. Toxicology. Toxicology ends up becoming a joke in conventional medicine or conventional nutrition advice because what happens is a lot of these nutrition experts people sometimes ask me, why don't you quote so-and-so? Why don't you quote so-and-so? And I'll tell you something. If a nutrition expert is trying to sell these products, in my opinion, they've sold out, okay? Anybody who's smart, who reads the papers on this stuff, knows that it's bad for you. It's obvious. Okay, everybody says, oh, stress is bad for you. Excess stress is bad for you. Well, caffeine just does the exact same thing. Elevates the same hormones, catecholamines and cortisol. Why wouldn't that be bad? Oh, tea is so good for you. Well, concentrating, aluminum and fluoride is not good for you. I know they say you don't absorb as much of the aluminum that's from the tea, but it also concentrates F minus. Some of the brands concentrated other toxic heavy metals in the book by the so-called Health Ranger guy. Mike Adams, I think is his name. Anyways, all this stuff is bad, and you'll see so-called nutrition experts promoting all this stuff. Olive oil, saying MSG is okay, dancing over F minus, all this stuff. Okay, so that's why you'll notice that if somebody's doing this stuff, I don't recommend them as a nutrition expert because sometimes they'll play a game, I will call it like the 50-50 game or the 70-30 game. They'll tell you mostly correct information, but they'll lie to you on important issues to sell these things. And I wouldn't be surprised if they're getting paid by industry to do that. Establish some credibility and then sell the product, okay? And I don't even monetize my channel. I don't make any money. I just do it as a hobby. Okay, infection. Infection is complicated because the germ theory is true in a lot of ways, but it's exaggerated. The terrain theory is underestimated big time. I mean, if you make a healthy immune system, you're much less likely to have these problems. Okay, cancer. Cancer is totally exaggerated, this whole somatic mutation theory, okay? There's a little bit of truth in it. 1 out of 5 stars I give the somatic mutation theory for cancer, but it is totally exaggerated. It's mostly bogus, and I've talked about that plenty in my cancer lectures. The real way to make sense out of cancer is go through the metabolic theory of cancer. Again, I made a bunch of lectures on that. I wrote a whole book on that, Poor Man's Way to Fight Cancer. Shows the mechanisms by which excessive dietary fat, estrogenic chemicals, glyphosate, omega-6 oils, animal protein, circuit inhibitors, mitochondria, they all contribute to causing cancer. And once you understand the metabolic theory, what's great about it is it tells you exactly what to do. Avoid all the things that injure the mitochondria. Avoid all the things that activate mTOR. Avoid all the things that are mutagens. It's just logical. So, anyways, this is basically how I would divide disease theory. And so one of the things you notice, conventional medicine kind of pretends it's scientific, but it's really a joke, okay, the science and the logic behind it. Basically, say you don't know what the cause of something is, declare that the disease can never be cured, and then just say people have to take your drug. Okay, that's bullshit, all right? And that's what conventional medicine is largely based on. That's the majority of it. The majority of patients have chronic diseases, and they're told that nobody knows the cause or the cure, and it's impossible to cure the disease, therefore they have to take a pill. That's your, atherosclerosis, diabetes, hypertension, fatty liver. These diseases are so common, it's just assumed the patient probably has them after 50 years of age. Whereas all this stuff, doctors don't know this. They're not trained in any of this. So anyways, that's how it is.